We're going to talk about sterile procedure today, how to put on sterile gloves and then take off gloves. As you know, sterile means without microorganisms. So we have to make sure, keep in mind that everything that we use that is sterile stays that way. Constantly has to be in your head. If you even forget to, and you touch something, you're no longer sterile and have to do that procedure over again. So I'm going to use an actual sterile tray, a kit that comes with sterile gloves, and I will use that and show you how to keep all of that sterile. But the main thing I want you to see is how to keep your gloves sterile and how to take those off. Okay, first thing I'm always going to do before I start anything is wash my hands. So I will get that process started. Make sure it's my hands so I don't get the germs back on my skin. Dry my hands real good. Keep in mind, anything that's wet cannot be considered sterile. Okay? So I'm going to use the dry part of my paper towel. Get a new paper towel. Make sure my hands are good and dry. Use the dry part of my paper towel to turn this knob back off. Okay, I don't want to touch that because I touched it earlier with my dirty hands. Okay, so now I'm going to open up my tray. This is my sterile tray. Maybe if I can get it open. Tray. Now keep in mind, this is the outside, so it will be touching counter space or whatever else. So this outside is not sterile. Okay, I always open up a sterile field away from myself so that I don't spill or spit on it or anything else, get hair on it. Okay, there will be a corner as such. We'll open it. Now, when you open up a tray, anything along the outside 1-inch perimeter is not sterile, so you can touch that with your clean hands. Okay, so I'm going to go ahead and open this up. Sometimes they get kind of sticky, so, and I don't want to lean over my sterile field because I don't want to get hair or anything in it. Okay, so now remember, the back side is not sterile, but this top side is. So everything within the 1-inch border around this is sterile. No germs have ever touched it, and I don't want germs to touch it. Okay, so what I'm going to do is I'm going to make sure that I'm careful. The only thing I'm going to touch in here is my gloves. Okay, these are my sterile gloves. They come in a package. I can touch this package. I'm not going to hurt anything. Once I touch the gloves or the inside of the package, then I have ruined it and I have to start over. Okay, as far as this procedure goes, everything else in here that I need is sterile. So I'm going to move this to the side so I can put on my sterile gloves. Remember, I can touch the outside of this. Okay, sterile gloves, like I said, will come in a package as such. Something similar. Okay, when you open them up, they have a cuff on the inside. Now keep in mind, this is part of the inside border. So it will be, I can touch it with my hands. Okay, it's the inside that I have to worry about. So we're still good. Now lay these flat on the table so that I can get to these cups. It tells you which side, thumb on the left and then thumb on the right. So I will open them up and spread them out. Okay? Now, remember, 1-inch border. Now, think this through for a minute. And that's what sometimes you have to sit and think things through when you're working in the sterile field about what's clean, what's sterile. Remember, sterile is no germs. My hands are clean, but they still have germs. Washing them in water doesn't make them completely sterile. So when you think about these gloves, think about what part is going to be clean, like my hands, and what part is going to be sterile. We know the outside has to stay sterile so that we can do this sterile procedure. but the inside doesn't, because it's going to be touching my hands. So I'm going to put the glove onto my non-dominant hand first. For me, that's my left hand. So I can touch the inside of this glove. And see? Touch the inside of this glove with my clean hand, non-sterile hand, and I can use that to guide in my left hand. Okay, so as long as I don't touch the outside and I don't touch my field right here, we're good. I'm going to make sure I locate the thumb, and I'm going to go ahead and put this glove on. Now, sterile gloves come in different sizes, and usually if you're going to be using them on a regular basis, you'll have an idea of what size that you need. I wear them 6.5. Okay, so as long as I'm still touching just the inside, I'm good. Okay, so see how it's cuffed? I'm going to go ahead and pull that down using the inside so I can make sure that I've got my whole glove covered. So now I've got one clean, non-sterile hand and one sterile hand. If at any point in time I touch myself, I touch any part of a non-sterile field, then this no longer is sterile enough to get new gloves. Okay, so I haven't touched this glove at all yet. It is still completely sterile. So I'm going to take this glove, and if you can see how it's held in here, it's got a cuff on it as well. It's got the cuff right here. Okay, so I will take my 4 fingers on this hand, cuff them inside of this one, like so. You see that? Okay, once I do that, remember this hand is clean, it's only going to touch the inside of the glove. So, I'm only touching the inside of the glove. So now I've got my gloves on. Sometimes they get hung up on your thumbs, and now I can touch anything. I can touch my 2 gloves together because they're still sterile. But anytime I touch myself, touch anything else that's not sterile, I need to get some new gloves. But these are sterile. Okay, so now this is still sterile in the middle, so I can move that, throw it away. Now I can bring my other procedure back to me. This is a drape. This is another drape. It lays on whatever body part that you're working on, and then I can work in here as I need to. I just have to be sure that I do not touch the outside rim of this field, and I don't touch anything else. But all of this is still good. Okay, all of this is still perfectly good. So I can touch any of this I want to until I touch the patient or touch something else. That is sterile procedure. That is how you put on sterile gloves. It's just a constant reminder to make sure that you don't touch anything that's not sterile. Sometimes I put my hands together to remind myself. Another good thing to know about staying sterile is that once your hands go below your waist, they're not considered sterile anymore. It's just a surgical rule. Doesn't necessarily, I think, mean that there's germs on them, but that's just part of it. That's why doctors, when you see them on TV, they always have their hands up here, because they're no longer considered sterile once they go below their waist. Another good thing to know is that my sterile field right here, if I were to turn my back, this would no longer be considered sterile. And that's just because if I turn my back and the fly lands on here and I turn back around and it flies away, I never see it, brought some germs onto my sterile field. And generally speaking, sterile procedures, you're doing that so that you don't put any germs onto the patient that don't need to be there. Okay, to remove my gloves, keep in mind, once I've used them, they may have blood or some other kind of body fluid on them, urine, whatever it is. I still don't want that body fluid to touch my skin. So I'm going to take my gloves, I'm going to pull from the middle and pull this one inside out onto itself. So now all that's exposed is the inside, which is not, it's still clean. It's not sterile, but it's clean because that's where my hand was. Now I need to get this glove off. Okay, I don't want to use my hand to touch those body fluids, so I can go from the inside, right here, okay, and pull that one off inside out, as such. So now I'm only touching the inside part of my gloves, and I can throw them away without getting body fluids on me. Next thing I will do is go back and wash my hands. Anytime before gloves and after gloves, you always wash your hands. And that's just because you don't know, what if you had a little hole in your glove, or you had something else you didn't realize you were exposed to. And also because some people are allergic to different types of gloves, and so you need to make sure that you wash them in between, so that if you go to a patient the next time who has a latex allergy, you're not exposing them to that allergy. Okay.